With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride. Lulu Money, Snehapurvam.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hi all, it's me Nikita and we are here with another episode of BMC Global Live Health World in association with Al Hilal Hospital, Bahrain. A healthy outside starts from a healthy inside. Today we have Dr. Bushra Al Sharaf with us to talk about diabetes mellitus. She is having 19 years of experience as working family medicine consultant in Bahrain. She is currently working in the Salmabad branch of Al Hilal, Bahrain. Hi doctor.
Hi.
Okay, so today we are going to talk about diabetes mellitus. So, diabetes mellitus is more commonly known as diabetes. So, can you explain what is diabetes or what does it mean when a person is having diabetes?
Actually, we have two types of diabetes. The first type is called insulin-dependent diabetes mellitus, and from its name we could understand that the person who have this type, they need insulin because the pancreas, it will not be excreting of insulin at all. And the second type, it is called non-insulin dependent diabetes mellitus, which is type 2. That means the pancreas, they will be secreting of insulin, but they are not enough, or the cell of the body will not be effectively reacting to these secretions of the insulin. That's why there will be an insulin resistance.
Okay, doctor, since we are in Bahrain, how common is diabetes mellitus in Bahrain?
Bahrain is one of the countries which they have a high prevalence of diabetes mellitus. It is about 14.7%. And actually, in the worldwide, China considered is the first countries who are a highly prevalence of diabetes. They have around about 116 million cases. And the second country worldwide is India. It is about 77 million cases.
Doctor, what are the risk factors that increase this likelihood of diabetes?
The risk factors, it depends on the type of diabetes. Actually, in type 1 diabetes mellitus, the main risk factors is a positive family history. But in type 2, family history is also one of important risk factors, but there is other factors can play a role, which is a sedentary life and a high also cholesterol levels with a high blood pressure. They are more prone to develop a diabetes mellitus. As well, overweight and obesity and uncontrolling of the food is also one of important risk factors to develop type 2 diabetes mellitus.
Doctor, what are the symptoms of diabetes mellitus?
The symptoms of diabetes mellitus, there are three main symptoms. I will start with polyphagia, which it does mean that increase of the hunger. And the second one is the polyuria, that there is excess going to pass urine, especially during the night time. And we have a polydipsia, which is increasing of the drinking of fluids. And there will be also another symptoms associated with all these three symptoms, including of unexplained weight loss, feeling tired, fatigue, as well as headache, and they can be having also delaying of wound healing and recurrent of fungal infections which is not responding to the regular treatments.
Doctor, for a person, what should be the fasting blood glucose level be?
In a normal person, the fasting blood sugar, it should be 5.6 millimole per liter, which is equal to 100 milligram per deciliter. And there is a condition called pre-diabetic. This is the fasting blood sugar. It will be between 5.6 to 6.9 millimole per liter. That means he should follow his fasting blood sugar and check it more regularly because they're more prone to develop a diabetic condition.
As a doctor, how do you diagnose diabetes mellitus?
Actually, diagnosis of diabetes mellitus, we have three lines. First one is depending on the fasting blood sugar, which it should be a 2 reading in a different days after a fasting of 8 hours. And it is diagnostic when the fasting blood sugar is equal to 7 millimole per liter, which is equal to 100 milligram per deciliter. The second diagnostic line is depending on postprandial, that means after food of 2 hours, it should be 200 milligram per deciliter, which is equal to 100 millimole per deciliter, which indicated of a diabetes. The third is the hemoglobin A1C, which it will be actually showing how is our body react to the sugar for the last 2 to 3 months, which it should be below 6.5%, which is equal to less than 48 millimole per liter.
Okay, doctor, why do you recommend to do the blood test for sugar after fasting?
Because according to the research, the first line they depend to diagnose diabetes mellitus is depending on the fasting blood sugar.
It's all about the moderation in food choices and careful decisions when they eat something. So as a doctor, what do you recommend to people with diabetes? How should their diet be?
Yeah, actually diet in diabetes mellitus is very important because the first line we have to take care about our diet and second about our exercise. Diet is very important. You have to avoid all the highly sugar content foods, like even dried fruit, which is highly content of sugar. It should be avoided in diabetic, and they be shifted to fresh fruits especially like apple and orange. Also, they have to avoid all canned foods, all kind of sweeteners, and they be shifted to all grilled food. Try to avoid all oily food and start to take all low-fat diets. And also stop smoking and alcohol. It will play a very important role in diabetes mellitus.
Doctor, physical activity is important in anyone's life. So for a person with diabetes mellitus, how often should they exercise?
According to American recommendations, they recommend to be having an exercise for diabetic patients, which is about 150 minutes per week, which it will be like about 20 to 30 minutes a day. And the most exercise which is benefit from it, it will be walking and swimming and cycling.
Doctor, what are the major complications related to diabetes mellitus?
Actually, diabetes mellitus, they have a very wide range of complications. It can be affecting a lot of organs in our body, starting from our eyes, which it can be a very damaged complications to the eyes, like retinopathy. They can be affecting the heart, the function of the kidney. They can reach even a renal failure, the functions of the liver, the function of the skin, the function of the nerves. They have a lot of complications. That's why we are taking care about all diabetic patients to be controlling their blood sugar to not to develop of these complications which is affecting their life.
Doctor, why should a person with diabetes do a screening for the kidney function?
Because diabetes mellitus can directly affecting the kidney function. And when there is a damage with the kidney, we cannot return the cells which it get damaged. And there is a lot of cases of diabetic, they have a renal failure. So the glomerular filtration rate and the checking of the kidney functions, it should be on the spot. Whenever any person is diagnosed with diabetic, he should do it at the diagnosis time and then to be repeated annually if it is normal.
Doctor, what is the target of this treatment of diabetes mellitus?
The main goal in the treatment is to control the blood glucose level, to not to have complications.
Doctor, are there any difference in the treatments for type 1 and type 2 diabetes?
Yes, as I mentioned before, that type 1 diabetes mellitus, there will not be an insulin secreted from the pancreas. So the only treatment is to give them an insulin. But in type 2 diabetes mellitus, there will be an secretions of insulin, but it will not be sufficient. Or our cells, it will not be react effectively to this secreted insulin. So the treatment of type 2 diabetes mellitus, starting from controlling your diet, from exercise, controlling our lipid profile, controlling our blood sugar, and then they will need medications as well. Maybe at the end they will be needed of insulin if all these components will not work.
Okay, so doctor, what are the medicines that you recommend to people with diabetes mellitus?
Actually, there is a wide range of groups to be used for the treatment of type 2 diabetes mellitus, but the first line used to be treat the diabetes mellitus type 2, it is called metformin, which is glucophage. These actions, they are acting on the liver to be decreasing the productions of the glucose and increase the sensitivities of the blood cell to be react to the insulin. So it has the first line treatment of the diabetes mellitus because it is the safest, as well as it has a less side effect than other medications.
Doctor, what are the side effects of taking metformin?
Okay. The side effects of the metformin or the glucophage, it is mainly in the gastrointestinal tract, could be including of abdominal pain, nausea, vomiting, bloating, gases, constipations, or diarrhea. So that's why it is preferred to be taking of these tablets combined with a meal.
Doctor, is there any other medicine that you recommend for people with diabetes?
Yes. The second line of the management, if the people who are having diabetes mellitus not responding to a glucophage, which is the doses we can start is a 500 milligram once a day. We can go to up to maximum doses of 2,500 milligram. We can go to the second groups, which is called sulfonylurea, including of dimacron, which is dimacron. Also, it has an side effects, including of the same as the GI tract complications of the glucophage. As well, it can cause another complications like palpitations and dizziness. And the two important complications of both of these drugs are the hypoglycemia, which is a very risk factors for the diabetic patients.
Doctor, how is metformin different from dimicron?
Yeah, actually glucophage, it has a different action than the metformin. The glucophage, it will be reacting on the liver to be decreased secretions of the glucose, whereas the metformin, it will be acting on the pancreas to be increased secretions of the insulin. As well as the dose, it will be different. In metformin, the dose is starting with 500 milligram once a day, reaching to a maximum dose of 2,500 milligram. Dimacron starting with a dose of 30 milligram and ending with 120 milligram a day.
Doctor, we have also heard about hypoglycemia. So can you tell us what is hypoglycemia, its symptoms and causes?
Actually, hypoglycemia, it is a very important and a dangerous complications for diabetes mellitus, both types. We consider the person having a hypoglycemia when he check his blood sugar and it is equal to 3.9 millimole per liter, which is the symptoms starting from sweating, palpitation, dizziness, confusion, even they can go into coma and loss of consciousness. And it is very important that to educate all the diabetic patients how to react against this hypoglycemic attack, that immediately they have to take any type of sugar or any type of a piece of chocolate or a drink and a fruit juice and check their blood sugar after 15 minutes. If still it is showing 3.9 millimole per liter of a sugar. Again, they have to repeat to take a piece of the sugar. As well, we can teach them how to take a glucagon injections to be increasing of the glucose secretions into the blood.
Doctor, if you consider the case of pregnant women with diabetes, are there any complications in them?
Yes. Actually, complications of diabetes in pregnancies, it will be on the fetus and on the mother. On the mother, they can have any type of complications as a non-pregnant woman. Like they can affect her eyes, kidney, livers, nerve, all the complications, it will be the same. As well, it will be increase her incidence to have a diabetic after delivery. On the baby, they can have a big size of the babies, so while delivery, they can have a nerve injury, they can have also a heart complications on the baby.
So thank you, doctor, for sharing us your time. I really appreciate for sharing some information and advice. This was really enjoying.
Thank you very much, I enjoy it.
So viewers, we come to the end of our program. Without your continued support, we won't be able to put up programs like this. So please don't forget to like, share and subscribe our Facebook and YouTube channel. This is me, Nikita, signing off. Thank you.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും.
ലുലു മണി സ്നേഹപൂർവ്വം.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.